Hello viewer, welcome to today's episode of Health Talk Show. We have beautiful guests in the house who are going to take us through something very common, especially today during the COVID-19 era. We are discussing about teenage pregnancy. It is really affecting our girls in primary and secondary schools and some of them in colleges. Today we are going to go through it and I'm sure you're going to enjoy the show. I'm your host, Lucy Wanza-Kariuki, and I'm going to let my guests from the farthest end to introduce themselves. Kindly introduce yourself.
I'm Jane Karaja. I'm a nurse counselor. I've done nursing, counseling psychology. I've also done mediation, so I'm a certified mediator. I work in a trauma area, in the area of my work.
Thank you so much. Welcome, Jane, to the show. Yes.
Hello viewers, and my name is Helen Kanjagwa. I'm a psychologist. I'm a practicing certified psychologist. And I'm happy to be here today with you.
Welcome to the show. I'm sure it's your first time to host you, but I'm sure you are going to enjoy the discussion. We are in an era that many girls have really faced a challenge, whereby parents do not know which way to go. Technology and many things have affected our children. During the COVID-19 era, it was stay at home, and a lot of things have happened. Let us begin by speaking about teenage pregnancy. Jane, kindly introduce us to teenage pregnancy.
Well, basically, teenage pregnancy is a pregnancy that occurs to a girl who is between 10 to 19 years. Basically that, whether married, whether not married, intended or not intended. Yeah.
What is the burden of teenage pregnancy, Ellen?
What I would say globally, the burden is really felt because we find that approximately 21 million teenage girls get pregnant and 12 million give birth. That is between the ages of 15 to 19. And below the age of 15 to 19, we have around 777,000 girls giving birth as well. In Kenya, we find that one in five, actually the burden is around 18% currently. 1 in 5 teenage girls are either pregnant or have given birth to their first child. So the burden is really there and it's
very
felt.
hard.
Yes. Yeah.
Oh my goodness. If I may ask, what is predisposing our girls to all these things?
There are several things that predisposes our girls to early pregnancy. In some of our communities, there is a lot of forced marriage and early marriages. They are brought out of school to get married. And we don't have to talk about the communities who do that, even here in our RAD, but it is one of the things that really predisposes them. Then there is the issue of lack of knowledge, that there is use of family planning methods, contraceptives, and even those who know, it's like they are not able to go to where those services are offered, constraints from finances, transportation, and then the fear of being put off, stigmatized.
Yes.
You are supposed to be in school. What is this that you are asking? There are a number of issues anyway. Also the age at which teenagers are in. Confused and try to experience. And you know, there is something, and I've listened to most of the teenagers talk. Most of the time, what we are telling them not to do, that is what they want to try.
They want to try.
Yeah. So, and around that time, they are not even very well developed, both mentally, biologically, physiologically. They are not well developed, even emotionally. So even the capacity to restrain themselves from some things, even when they know they may be facing some consequences, they are not able to stop, to put a break.
Yes.
Yeah, if they start something, they want to go all the way. And that is something also that has really impacted. There is also exposure, a lot of exposure, media exposure. This era of internet, yes, we are being helped so much by the internet. But again, for those who don't, they're not able to choose what is good for themselves. And they are delving into, the malpractices, sexuality. There is a lot. There is a lot in the media.
Yes.
So most of them have gotten their exposure in that. They've been introduced. Also, where they come from, their environment, their homes, their families.
Yes.
If there's, we are looking at the, single parents families, the researches that have been done, they
Yes.
have revealed that most of the kids, most of the children, adolescents who get into early sex life are from single families.
Yes.
Yeah, and it also depends with how the single mother or the single father is behaving. Yeah, and most of them, there is a lot of negligence. They are left to feed on their own. Their hours are their own, because if it's a single parent, when do they go to look for food and school fees? And when do they look over the children? So that gap in lacking somebody who is watching over them exposes them to, exposes them. At times, they are left with house helps who also introduce them to sexuality.
Yes.
So there is a lot of predisposing factors. There is a lot of predisposing factors. And the most important, and what I keep on underlining, is the fact that they are not mature enough.
Yes.
And most of the time when these children are getting to adulthood, it's like for the parent, sasa wewe ni mtu mzima. You are grown up, you can do this and that. And when they are not doing, it's like wewe ni mtoto wa nani? Wewe ni mtoto wa nani? You are good for nothing. They are called all kind of names.
Yes.
And on the other hand, they are not able to handle those emotions. Those emotions, negative emotions, they are not mature enough. And so when they get somebody who is showing them love and concern, why wouldn't they just go ahead and do whatever they are being asked to do? And then there is also the issue of coercion. They're being coerced, raped. Okay? Most of them are introduced to sexuality by older persons.
Yes.
So like the girls are so helpless. They don't have that strength
to defend
say
themselves.
no.
Yes.
And then when they are facing a more grown person who is more wise, more manipulative, more cunning, and they are enticed by very small things. Yeah, those are some of the issues that have been predisposing girls to early pregnancies. Yeah, and then can you even forget the issue of peer pressure?
Peer pressure, yes.
Yeah, everyone is doing it.
Why
Everyone
not
is
me?
doing it. But when they are telling each other, everyone is doing it, they are not advising each other on preventive measures of at least preventing themselves from getting pregnant. And those are the things that go with sex, diseases, sexually transmitted diseases. They don't advise others, but they will bully each other. When mshaba.
Yes.
You've not done this. Connie, it's like everyone is laughing at you. And for a teenager who is learning and wants to have a sense of belonging, they would definitely try so that they can have a story to tell.
Yes.
And on the other hand, if they are going through such bullying, and then at home it's no better, they are being taken good for nothing. Yeah, they are not grown enough, and they are adults, according to the eyes of the parents or the guardians. It becomes, it's like you are pushing them to do the negative things.
Sure.
Yeah.
Wow.
Yeah.
Ellen, Jen has spoken of many predisposing factors, but 3 have captured my attention, of which I would like you to speak something about them. One of them is social media. The other one is these children being left alone. And the third one is about family planning. They are teenagers.
Yeah.
The nurse is there in the MCH family planning clinic. And a teenager of 13 comes. Oh my goodness, kindly speak about the 3.
Wow, yeah. Let me start with the contraception part.
Yes.
That has been a big gap when it comes to helping these teen girls. because the limited access to contraception is there.
Yes.
Most healthcare providers won't understand why a 12, a 13-year-old is coming to get family planning. So we find that they are turned away from it.
Yes.
And they end up now engaging in unprotected sex as a result. When we talk about neglect, yes, dysfunctionality in families leave most teenagers feeling neglected. And that is why we find they end up developing very negative attachment style. There's one we call disorganized, disoriented attachment style, which is as a result of the neglect from the caregivers. So you find that when they grow up with this, they are looking for some secure attachment. And the person who can easily provide this is their boyfriend, okay? And with the limited access to contraception and knowledge as well, they'll end up engaging in unprotected sex. So what's the result? Teen pregnancy. So you find that those are really, they like go hand in hand, the two issues. And
For the
then media.
contraception, what does our country say? The laws.
Okay, as far as the law is
Are they supposed to access or denied?
from where I see it,
Yes.
I'm not sure if they have really put it clearly out there
Yeah.
that they're supposed to, to access the family planning. And that's where the gap is. So we are not really, you know, if it's passed on.
There's no clear cut.
Yeah, there's no clear cut. Some are
Yes.
saying yes, some are saying no.
Okay.
But we encourage them when we, especially the teen mothers,
Yes.
you know, after now they have,
Delivered.
yeah, they're delivered. Honestly, you really have to save them from a second pregnancy. So we encourage them to seek family planning.
We seek
Yeah.
consent of their parents
Yes.
or caregivers.
Yeah, exactly. The caregiver must be involved in the whole thing, you know, even in the discharge, so that they can also guide them towards the correct family planning. Because, you know, even condoms are a good family planning method, which is actually the best alternative for teenagers, because there are also ramifications of this long-term type. So, yeah, the caregiver is also involved.
Okay.
Yeah.
Yeah.
Additionally, I think that also the government is trying to implement activities that are adolescents friendly in most of the services that are being provided. Even pertaining pregnancy, pertaining sexuality. And as my colleague is saying, yeah, information has not yet been captured out there. But yeah, the government has been trying to implement. There was a policy that was launched back in 2015, whereby the youth is supposed to be considered in no healthy services and not denied, and being empowered to know that they have a right
Yes.
to go for those services, either family planning, attend antenatal, without any intimidation. And in some hospitals, actually, they have taken in those policies, yeah?
Yes.
Like, I've seen, like, in Kenyatta National Hospital, for those who have visited, when there is a youth clinic that attends to the youth at those age groups. And when they are captured whether pregnant or presented with any other issue, they are taken all the way. And they are educated. And they are empowered on what and what they can do, even regarding, you know, sexuality, regarding family planning.
So the problem may be the attitude
The attitude
of everybody.
Of
the,
everybody,
The
yeah.
community, even the health workers.
I really-
Because you could be like, do I give a 13-year-old? Suppose
Yes.
it was my daughter.
Yes,
Suppose it was me.
yeah.
So we could say that we cannot blame the laws of the country.
We cannot
It is
blame the
us.
law. It is
But
us,
if
actually.
possible, let us offer the service.
It is true.
Thank you so much. Jen, Ellen, sorry, you were on social media.
Oh, yeah.
Yes.
Yeah, that is a big risk factor
Yes.
of teen pregnancy, because we find that, you know, in our days, you'd find that having a boyfriend at the age of 13 was unheard of. But nowadays, you'd see even 13-year-olds posting their partners on social media. They're making it look so normal.
Yes.
So you find that influence, they're normalizing these things. They're normalizing having early sex. They're normalizing family planning. They're normalizing those things that in old days were not really normal to us. So you find that the media influence is really playing a big role in teen pregnancy, because in the older days, you find that if a young girl got pregnant, it would look like a very big deal in the
Taboo.
society. Yeah. But nowadays, life moves on. The 13-year-old gave birth. It's okay. So you find that even when they get pregnant, some of them don't take it as a serious thing. It's normal. I'll just give birth and life moves on.
Yes.
You know, you'd even find a 15-year-old with 2 kids, and it's just normal. So I think the media, you know, is really playing a big role, because such things are being normalized as opposed to the past. Yeah.
Being left alone at home.
Yeah.
Yes.
Yeah, being left alone at home, this goes hand in hand with the parenting style.
Yes.
Because you find that most parents nowadays are out there chasing their careers. So they usually don't have time to even know what this child is doing at home. And the kind of things they're even searching in the internet, you'd be surprised if you take their phones, because they are really, you know, they're not education oriented kind of stuff. They really search things concerning maybe even, you know, about sex. Some will even, like, the kind of things they're looking up out there are really not beneficial to them according to their age. And the parents have really been hands off as far as this is concerned. They'll leave them at home. They'll even not really be keen to know what they're really watching,
Or
you know,
doing.
or doing with their
Yes.
phones. Yeah, so that neglect is really playing a big role, because I feel if they're involved in their teenagers' lives, knowing what they're up to, knowing what they love watching, they might be able to offer support before it's too late.
Yes.
Yeah.
Wow. Are there children, Jane, who are at more risk of teenage pregnancy than others?
Yeah, their children. Yeah, their children who are at
Teenagers,
risk.
let's call them teenagers.
Yes, let us
Yes.
not undermine them.
Yes, teenagers.
They are teenagers, yes, who are more predisposed to early pregnancy. Like those who come in communities where they allow for that, they allow for early marriage.
Marriages.
By the time the girl is 10, could be already she's betrothed to somebody. Yes, and then puberty. Puberty are those who come from low socioeconomical status. Usually they are at a very high risk, because most of them, they don't receive education. And you know, education opens one's mind. Yeah? They are able to listen. They are
Yes.
able to say this is good, this is bad, you know. And also it buys the child's time when they are in school. So those who don't go to school, it's like, what am I doing at home? Yeah. And even the parents, you call ask them, what are you doing here? Why are you wasting time here? You're not working. Go ahead, get married. Could be even the parents will benefit more from the marriage of the girl.
Yes.
So the community can really predispose them from getting married earlier. Okay, the socio-economical status.
Yes.
Yeah, that plays a lot. That one plays a lot. And when now they don't go to school, that's another thing. I was checking on some of the researches, and they were saying those who have not gone to school, they are 5 times likely to get pregnant than those who have gotten to schools. Yeah. Yeah.
Wow. So there is a lot of work to be done.
There is a lot.
Because if these children are at more risk than the others, then what next?
What
Oh my goodness. I would like to know now, the young girl is now pregnant at the age of 12, 13, 14. And now the title of the girl changes. She's no longer a girl, but now a mother. The pregnancy may be not from even a senior person, a fellow teenager.
Yeah.
How is it like teenage motherhood and fatherhood? Where do we start, Ellen?
Yeah, it's very challenging. The
Yes.
challenge is felt because one, like my colleague says, the age. This is okay, it's still a child. This is still a child. At 12, you're supposed to be developing biologically, emotionally, in all
Yes.
aspects. So the moment this title changes to motherhood, definitely there are physical changes that one will experience. We are not saying they are bad, but according to the age they are in, stigma will be there. Self-stigma, social stigma. So that is one challenge they face. That is now for the teen mother. Another thing is low self-esteem can be associated as a result, because like most of them hide out. You know, the moment they are pregnant, they'll stop even going to school.
Yes.
They'll stop even going to the shops. They just want to stay indoors. Some will even wear clothing to cover up, showing that the confidence level has really gone down. Others will even be affected academically, you know, once they realize that, you know, now they're mothers, they'll have a lot of thoughts. And this applies to also the teen fathers, because you find that most of them are caring, even if they are fellow peers or fellow age mates. Some will really feel that change. Now I'm a father. They are worried about the teen mother. They're worried about the health. They're worried about the new baby. Some will want to provide. They don't know how to start. They're still in school. This will affect them academically as well. And the worst that happens is them dropping out of school, because you find that some families will force these teen fathers to marry the teen mother. So you find that they no longer continue with the education. So it affects the teen fathers as equally. Okay, the impact is felt more by the teen mother, but the teen fathers are equally affected. Yeah.
Wow. Yes. So the mother has some effects.
Yeah.
Jane, how do you take us through the effects now? It has happened. We can't change it. The girl is now 3 months, because I'm sure for a teenage pregnancy, by the time we realize it, some of them are already across or have crossed the first trimester. We seeing the bump. We seeing the abnormal behavior, because as Ellen said, the parents sometimes have disconnected. They've not even realized that something is wrong. But there are some effects which come for the teenage mother and for the teenage father. As Ellen also speaks about the effects to the parents, to the community, to the school and everybody.
Yeah.
Yes.
There are many effects when a teenager gets pregnant
Yes.
or becomes a mother. As we have said several times, one of the things is that they are going to drop out of school. Actually, it is not that 99% of those who get pregnant in their teenage, they drop out of school. So you can imagine only 2%.
Completely.
Yeah, completely.
Yes.
Yeah. There are those, of course, who they'll drop out and then get back to school after a while. Yeah. So that they'll take more time also in getting their education. Yeah, in that 98% that drops out of school so that they can give birth, there are those who will get back to school. There are those who will not. They'll go ahead and get married.
Yes.
And that percentage is not small, either way. Either way. So there is a lot of effect. When this mother, again, a teenager and becoming pregnant, and they are still developing, there is a lot of, we have talked of socio-economical, yeah? There is a stigma, as we have said. They are also not empowered economically. So even taking care of themselves, they are not able to take care of themselves. Most of them, they don't even attend the antenatal clinics, of course, for the fear of stigma, you know. They also don't want to be seen. What happened? They end up carrying very unhealthy pregnancies. Yeah, you find them having preterm births. They may get infections themselves. They are so predisposed to having high blood pressure, a condition that is called eclampsia, which lists them, which has got very high mortality, very high mortality. So the same teenagers end up losing their lives, if not pregnancy. And when at the same time, you know, there is a whole lot of it, sexually transmitted diseases.
Yes.
They also end up even having HIV infections. And they lack support. Most of the time they lack support. One thing is because they are not disclosing their status. They have not told anyone.
Yes.
So they are, carrying the burdens on themselves. The challenges they are experiencing. They are not able to tell anyone because they don't think anyone is going to listen to them. So they end up experiencing a lot of psychological trauma. Some of them end up getting depressed. And even after delivery, they may even get psychotic. It's a whole lot of things. And also now when they get to giving birth, they are giving premature babies, long time hospitalization. The babies that have been delivered again, being premature, some of them end up, dying. And you can imagine the impact it is having on this young child. And they also don't grow normally. I think they don't grow normally. You can imagine this teenager who is supposed to be growing, still forming on their formative years, if I could say that, because they are not completely grown.
Yes.
They have their needs. They need to be looked after. But now they are looking after something else that is even beyond them. It could be they have even been rejected by those who caused their pregnancy. And if not being rejected, whoever caused them to be pregnant is not able to do anything for them. They are not able to take care of them. They are so afraid because could be the pregnancy was intended. They didn't intend. Because it is known, research is out there, say around 10 million of the pregnancies globally are unintended.
Sure.
Yeah. So a lot of psychological trauma, a lot of effects, a lot of burden. Even when the parents get to know, it's still a real burden on the parents who are now supposed to take care of two in place of one. And could be they didn't have that capacity. Again, the stigma for the family. And also when, lack of knowledge even and the skills of parenting. A whole lot of things learning all together in a life of a very young person who yet doesn't know many things about life. They were trying to discover, but then all of a sudden they're into a whole lot of other things that they didn't expect. Actually, it's something one feels like sympathizing. It's a situation that one feels like sympathizing with.
Wow. Thank you so much for that thorough discussion on the effects, because it is even very sorrowful to see it the way they go through it. Wow. Jane, Ellen, you were to tell us about the effects community. Everybody, even us here, as we speak about it. Yes.
Well, let me say, we found that, let me say, the effect is usually felt with the dropping out of school mostly, because you find that those are like lost dreams. We need our girls educated and our boys. So the moment they're dropping out of school, we are losing leaders. We are losing very big people in the society. Another thing is the early marriages. These are now the cases the psychologists we later experienced. These are people who married for the wrong reasons. They are not ready. So you find that this exacerbates a lot of domestic violence. In fact, there's a research that shows that early marriages end up having, there's IPV, intimate partner violence, experienced a lot in early marriages, because you see, this boy was not ready, or this girl was not ready, or if it's a senior person, they now start exploiting the young girl, you see? And that is really now a burden as a community, we feel, because now if there's violence, then it's not a good thing. So you find that as a society, we really experience that effect, and yeah, it's not really good. And then another thing is the single parenting. In addition to what Jane was saying is a predisposing factor, we have a family history of teen pregnancy. That predisposes.
Family history.
Yeah.
Mm-hmm.
Like you find that if your mother got pregnant at 16, there's a tendency of you getting pregnant at an early age. So you find that
Is it genetical?
I wouldn't say it's genetical,
Yes.
but you see, it's more of the modeling aspect.
Okay, okay.
You have a tendency of modeling your family history, you know, your grandmother. So you find it's like a pattern. So this is an effect as a society you feel, because you find that this girl gets pregnant, gives birth at around 13 or even 15. Chances are their child will also follow the cycle. And most marriages don't last. So we end up having very single parents, young parents out there. So it's a burden to the community. It's a big effect. Yeah.
This is GBS TV Africa. You're watching Health Talk Show. We're discussing about teenage pregnancy. We are going to continue right after break.